these are the first 7 days and they're phenomenal, but they can also be completely overwhelming. What you need to know, here we go. Number one, it is normal for the baby to feed every 2 hours. It can be normal for them to feed every 45 minutes. If you have any concerns, speak to your midwife, but know that it is very normal. They don't have the strength yet to be efficient feeders, so their feeds can actually take about 40 minutes to complete a feed. That's 20 minutes per breast. It's important to stimulate both breasts as much as possible. Even if the baby falls asleep, take off their clothes, try and get them stimulated to try and feed. They have very small stomach capacities, somewhere between 5 to 15 mils in the first 24 hours. They actually can't take huge amounts in, but that means that they will feed frequently. Now, often people get surprised by day 2, and what that means is when they come out, they can actually be a little bit sleepy, and you might get a bit of rest and think, oh, hey, this isn't that bad. What happens is they start to wake up. Now, they're designed to do that because they need to get that milk going to start their growth, but also to get their guts flowing. Which brings me to the poos. Okay, so for the first 2 to 3 days, we can have meconium poos, which are those dark green poos. But if baby is getting enough milk, that can be breast milk or that can be formula, depending on what you're doing, then that should turn to yellow by day 3. If it is not yellow, I want you to urgently go and see a doctor. And I know that sounds scary, but it is really important, okay? The poos for the first 3 to 4 days, those meconium poos, they can be really green and tarry and sticky. They're a delight, but they will pass as the gut starts to move. And the reason we need to be reviewed is there a reason for a slower gut? Is there a reason why the baby's not taking enough in? So that's what we're thinking medically if we see the meconium persisting beyond the day 3. Burping is absolutely not essential for newborns. You do not need to burp them, okay? It's also not essential as they grow older. You can hold them up and try positionally to allow them to have a burp if they need to, but don't sit there trying to get a burp out when they're tiny new babies. If it happens, it happens. It's just think about yourself. Do you think someone tapping you on the back is going to help you burp? No. It's a physiological thing that happens when the pressure in the air hits a certain amount. Babies can cry a lot and they can want to be held a lot. There's nothing wrong with your baby. Always get them checked out if you're concerned. But once you're reassured that there's nothing medically wrong with them, just know that they understand everything through touch. The more they're held, the more they will be calm. And it's an instinctive protective response. And when I say hold them, if you're looking at them like this, they feel nervous and it triggers off a startle reflex. So when you hold them, they want to be close to your body. Always make sure that they can breathe, but however you're holding them, keep them nice and close. I recommend having a baby carrier, a soft baby carrier like a baby Catan from Day Dot, and using that in the hospital just to help with your hands and things like that. Have a look at the safe baby wearing guidelines so you know what you're doing. Baby's head should be very close to you. Their spine has to be straight. That's very important. If your baby has jaundice, it's not normal in the first 24 hours, but after that, it can be very normal for that to develop in the first 7 days. It's a very common thing. It's very scary as a parent, but just keep getting reviewed by your doctor and your team. If your baby is sleepy and jaundiced, always get an extra review. But if what we want is a vigorous, alert baby, and know that sometimes they can be jaundice that starts off a few days after birth and continues. If it happens the first 24 hours, you're going to be usually in a hospital anyway, and that's an urgent one that we need reviewed urgently. Babies can come out with a vernixy coating, which is protective, but they can also come out with unusual shaped heads depending on their mode of birth. If they've had a vacuum, if they've had a forceps, if they've had a vaginal, if they've had a Caesar. Now, all I want to reassure you is that it's all normal and it will all settle down. Even, we see some of the craziest cone shapes and it settles down. Okay, I don't want you to be too alarmed. Sometimes they can have a little bit of pain though, so that can lead to crying a little bit more if it's a very painful one. Now, baby poos. I think I went into the meconium, but I didn't tell you how many poos you need. So we usually say from day 2 onwards, we want at least 4 to 6 poos per day. That means you're getting enough milk. Sometimes that may be a bit slower as your milk is coming in, but that's what we want. That also leads me to the hard breast. For mum, your breast can be extremely hard. That's due to your lactating breast suddenly coming into its function. It's never worked like that before, so there is a little bit of alveolar distension and congestion, which causes that rock hard feeling, and it is like rock hard. It will settle down. If you have too much pain, ice is the best thing, ice and ibuprofen, okay? And it's normal, it will settle down. Now, you might also have the baby blues. I hate that term, but it's actually a huge hormonal shift. Go check out my posts and on my Insta stuff on that. But I want you to know that it's okay, and it's not a reflection on you as a mother. It's not a reflection on you as a person. It has to do with the hormones that you're experiencing. And another thing there is not everybody feels an immense gush of love after they have a baby. It doesn't mean you don't love them. It's just our concepts of what it means to love your baby after birth are very limiting. So don't be surprised if you're like, what is this thing? What have I done? What have I let myself in for? That's just a normal sensation and thought as well. It does not mean that you are a bad parent. It does not mean that you are not cut out for this. It just means that this is huge and your life is about to change and your understanding of it. If you feel that gush and you're super happy and super excited, that's also completely normal and awesome. But the majority of people actually don't feel that. They actually feel this like overwhelm. The last thing is trust yourself. Your brain is changing. It's not you. Always get help. I always say to patients, I would rather see a well baby 60 times than a parent wait too late to come in. Get as much support and help as you can. Babies are very intense in those first 4 weeks. And you've got this. It's amazing. It's intense, but it's amazing.